Hi, everyone. This is Dr. Susan Marra with Dr. Marra's Medical Minutes. And today we're going to talk about quinolinic acid. Quinolinic acid is a toxic metabolite of the amino acid tryptophan, and um, it gets it gets produced in states of neuroinflammation and neurotoxicity by way of aberrations in the tryptophan and kynurenine pathway. And when you have a buildup of quinolinic acid, the brain is extremely irritable. It's just, it's inflamed, it's the brain on fire, it's agitated, it's it's just unwell. And when quinolinic acid builds up, what you need to do is you need to increase lymphatics, and lymphatics is the drainage of lymph out of the brain at night when you sleep. It's really important, and also to drain the lymph out of the head and neck down through the body so the body can process and get rid of those toxins by way of typically the kidney. The way that you measure quinolinic acid is you can measure that through a urine organic acid test, and it will tell you something about the level of toxicity that is in the body. And obviously, it correlates with the more neurosymptoms you have, the more neurotoxic you are, the higher the quinolinic acid is. The best way to neutralize quinolinic acid and bring the levels down is to use GABA. GABA, gamma-aminobutyric acid is the inhibitory neurotransmitter in the brain, and typically that is low in people that have high quinolinic acid. And so one of the best things to do is to take GABA. And GABA is a supplement. It can be a liquid or a capsule, and you can take 500 to 1,000 milligrams, and you should really start to begin to feel the brain just calm down. And when the brain calms down, then there's a return to some function, and you can see that the quinolinic acid levels are coming down, and you excrete them out through your urine by way of the kidney. So GABA is the best way to uh, sort of neutralize quinolinic acid, which gets elevated in states of chronic neuroinflammation. So toxic encephalopathy, Lyme disease, neurobartonellosis, neuroborreliosis. And we do see, in some patients, we do see elevated quinolinic acid. And so we use higher, maybe a little bit higher doses of GABA to help neutralize the quinolinic acid. So I hope you found this information useful, and I hope you have a wonderful day. Take care.